say howdy, you're supposed to say howdy back. Howdy. I'm Kehlin Swain, the co-founder of Greens Health, and we focus on keeping seniors healthy at home with whole person care, digital monitoring. We operate where policy momentum meets execution failure. There are 4 programs and services we take advantage of, from patients with multiple conditions like diabetes, hypertension, and chronic care management, to behavioral health integration, and as well as leveraging community health workers. There's a $50 billion investment being made in America for rural states, and it's primarily a broken infrastructure from our perspective. But 1 in 5 of these rural adults are living with chronic conditions, and the people who are taking advantage of this $50 billion investment by the current administration is the clinics. But clinics still lack coordination and also monitoring infrastructure. That disconnect is where we operate. My co-founder, Dad, Thomas, he was struggling to manage his type 2 diabetes. He had no coordinated monitoring, no proactive intervention, and found himself in and out of the emergency room. We enabled care for Thomas with a multidisciplinary team like a nurse, nutritionist, and social worker, at-home monitoring devices, and algorithms to alert our team when he's at risk. This is like a virtual care workflow where he gets connected with a community partner, he gets connected with nutritionists, but all this is coordinated in our software. And most importantly, one thing to look at as well is family-based education, where Thomas doesn't have to do this alone. So we got Isis, my co-founder, involved. We got Courtney, his wife, involved to put him on a diabetes plan and also educate them as well. This is just not all talk. There's clinical proof in theory. On average, patient reduced blood pressure by 5.6 milligrams and 4 months sustained engagement. We turned our first pilot into our contracted revenue for $24K. Currently, we're at $155 per patient per month. This is venture scale unit economics. Our total margin per patient is 40%. Our LTV to CAC ratio is 6.2x. These are real reimbursable codes. Everything we do is on a Medicare reimbursement plan. The way we separate ourselves from the market, like RPM vendors who do the tools and data collection, and care coordination teams who may have a nurse and team, we just don't collect data. We just don't have the nurses and the coaches involved. This is actually a coordination into reimbursable revenue that penetrates social and impactful measures. Not only that, we're leveraging things in the prediction market called digital twin. So we can do what if for the consumer and ourselves to see, hey, what if Thomas eats these chicken nuggets? What's gonna happen to his blood sugar? We're able to model it out in the future. We have a pipeline of healthcare plans, clinics to help us scale into our next season. Today we're talking about a $500K raise to get to our first 500 patients. We got 10% closed by Pipeline Angels, and Pipeline Angels here. Say who, if you're not, I'll talk to you later. But we're looking for partners. This is my co-founders and team, medical director, nurses, and my co-founder. And we're looking for financial partners today to help us close our next 500 patients to hit $1 million annual recurring revenue. Thank you.